The increasing costs of COVID-19 treatment by hospitals across the country is worrying the MPs, saying the poor may be at disadvantage since they cannot afford such costs. According to media reports, treatment of COVID-19 in private hospitals costs between 3 to 5 million shillings a day, costs an ordinary Ugandan cannot afford. This is the reason why the MPs want government to intervene and regulate the costs.
Without any policy, it is the role of government to protect people and property. And therefore, hospitals cannot continue exploiting Ugandans who are sick, and then we keep quiet as government. Just the other day, we saw Nakarema swing into action, move around parks, arresting bus owners and attendants. Why can't we see somebody moving to hospitals and ask why there is an increase of prices unnecessarily?
Someone is taking his own measures, the way we can milk from Ugandans. Every hospital is setting its own standard, but it's private. In Uganda, we had something called Kasao and Ingalonkaru. When you visit a medical facility, you have something, you'll be catered more. If you have no money, no one will care.
Some of the legislators have also expressed concerns over the high costs of testing for COVID-19.
Currently, we are spending 100,000. That is the cheapest fee one offers for testing COVID. That is still too high. It should come down to at least 30,000 because we are telling our populations to vaccinate after testing. But if the testing is expensive to that level and then the vaccination is for free, then it's as if you are refusing people to vaccinate. So it is better we make the testing cheap.
I'm also calling upon the owners of these private facilities to have the heart of this country. We should not use this opportunity to cheat our fellow Ugandans. We should not use this opportunity to actually, trouble our own people. The poor are now the most disadvantaged. We should take into consideration the lives of the vulnerable.
According to the MPs, inadequate oxygen in hospitals, high costs of treating COVID-19 and the high costs of testing the disease may escalate the crisis if something is not done by government.
I want to ask the Speaker at some stage that we need to come back as Parliament, see this as an emergency, and look for money to help Ugandans. Ugandans cannot die one after the other, and we are Parliament, and we are leaders, and we're just quiet about it. I think we need to come as Parliament, have a sitting specifically to discuss COVID, to discuss interventions by government, because Ugandans are dying.
We need an urgency meeting to talk about people being charged a lot of money.
Uganda has so far registered 68,779 COVID-19 cases, 584 deaths, with most of the cases registered in the second wave. Philip Aguta, UBC News at Parliament.